welcome to my office. I'm Dr. Sharoni, and today we're going to be doing a dental examination. Okay. Yep, I do see that in your file. You said you've been having like a little bit of like sensitivity. Okay, yep. Yeah, that's what we're gonna look at today. No, it's not necessarily a cavity. It could be like anything from just like gum recession, or maybe if you had like a little too much acidity in your diet. Yeah, but we're gonna check it out. That way we can like rule out like anything, okay? Okay, perfect. Okay, so before I get started, I do want to make sure that we're starting from a fresh slate. So what I'm gonna do is I'm just gonna brush your teeth, and then we'll have like a really nice clean mouth to work with. Okay, so I do have a little bit of water here, and I'm gonna use it to wet the brush a little bit, and then I'm going to gently brush your teeth. Okay. No, you're okay. It's actually very, very common for people to be a little bit nervous at the dentist, so yeah, you're not alone. But we do take very good care here to make sure that like your visit is relaxing. I know, I get nervous too, but yeah, it is something that's really good to do though, so that's why we take care to be like very, yeah, just very like soothing. So the toothpaste I'm going to be using today is a Crest Cavity Protection toothpaste. And this is regular. There's a little bit of fluoride. And it is an anti-cavity protection, so hopefully we'll be able to stop any cavities before they start. Yeah. So I'm just gonna go ahead, and I'm gonna put a little bit on the toothbrush. Okay. Yeah, very good. Okay, so if you could just open your mouth. Yep, as wide as you can. Yeah. Perfect. Okay. Does that hurt at all? Okay, it is a little sensitive. Okay. Yeah, I do have a couple products that I am going to recommend for that. Almost done. All right, very good. Now, since you are new to our office, I am going to do an assessment. That way we'll know what we're looking at, okay? So what I'm going to be using is a dental calculus remover. And I'm just going to go over and I'm just going to check your teeth. It's not going to be like anything harsh or anything like that, okay? Yeah, but do let me know. Yeah, if you have like any pain or anything, just let me know. And if we need to, I do have like a numbing gel that we can put on your gums that should help. Okay, so this is a stainless steel calculus remover. And it is a high frequency vibration, so that sounds like a really good thing, And an integrated design of the fuselage, which is more convenient, and it comes with a 5-gear adjustment. Perfect. Yep, so just go ahead and yep. Yeah, keep your mouth as open as possible. That way it's a little bit easier to see what we're working with, okay? Okay. I do see a couple small cavities. That might be part of what's going on. Okay. Yeah, I think I am going to go ahead and get that gel because it does look like you do have like a lot of sensitivity. Yeah. Okay. Yep, just on the back teeth. Is that okay? Yeah, I can kind of see that from here. Yeah, it's really just a couple small cavities. Yep, we can fix that. I might have to sign you up for like a future appointment. Does that work? Okay. All right. So yeah, just give me a second and I'll be right back with that gel. Okay. So this is going to be a numbing gel. It is slightly pink. It actually has a little bit of a bubblegum flavor. Yeah, I know. A lot of my clients actually really like this. So yeah, they also have it in mint, but I actually think the bubblegum is a little better tasting. So it is a little pink, but I am going to go ahead. I do have some gloves here that I'm going to use because I don't want to have any like direct contact with your mouth, okay? Okay, so. Alright. Yeah. So, do you like it? I know you just moved here from another city. Yeah. Do you like it out here? Yeah. I know, it's a lot hotter than the East Coast. But you know what? I prefer that to like the really, really cold winters. Yeah, I'd rather have it like 120 than like -20. Yeah. Okay, so yep, just open your mouth again, okay? And I'm just gonna go ahead, I'm gonna put a little bit, and it's gonna feel a little cold at first. But don't worry, eventually it's not gonna hurt. It's just gonna like make it so that you don't like feel any pain or anything. Okay, so very good. Okay, I'm just gonna put it just like a little bit. Yeah, it really only takes like a tiny bit. Yeah, you can feel it already. Good. Perfect. Yeah, it should be, should feel a lot better just when we do, like, especially we're going to do a little bit of scraping. Yeah. Yeah, you do have a little bit of tartar, so we should be able to take care of that today. Okay. Very good. Yeah, you can feel a difference. Perfect. Okay. All right, so you go ahead and finish checking your teeth. So far, it just looks like a couple of your back teeth have some cavities. I do see a little bit of gum recession as well, which is completely normal. Yeah, that's okay. All right. Just go ahead and write this down. Okay, so, yeah, just open your mouth for a second again, okay? Let me see. So it's gonna be the back molar. Okay. And incisors as well. Okay. Other than that, your teeth do look pretty healthy. Just gonna recommend a couple products for you. Okay. Okay. All right, very good. I'm just gonna go put this in your file, and that way, the next time you come in, we'll be able to just like get started right away. Okay. All right, so I'm gonna do a little bit of scraping, but before we get started with that, I just have a couple products I'm gonna recommend. The first is Act Anti-Cavity, and this is 0 alcohol, #1, dentist recommended, and it freshens breath, helps prevent cavities, and strengthens teeth. So I'm going to recommend this for you. We do have a sample size. We have like a little bag at the end. We're gonna do all that, but this is just like a really good product, and I do recommend using this right now because you do have like just like a couple small cavities. Okay. All right. And then we also have this Closest, which is like a pH balancer, and this is for ultra sensitive people or mouths. And it cleanses and soothes, and it helps improve oral health without irritation. So yes, this is really good to start with. Okay. And we also have some Listerine, and this is going to be Cool Mint Antiseptic. And it's for a fresher, cleaner mouth than brushing alone. Yes. Okay, so I'm gonna set these down, and then we're just gonna do just like a little bit of scraping because you do have some plaque. Yep, just a little, which is normal. Even just brushing alone, you can like miss some spots. Don't feel bad, okay? Yep, that's why we do these visits, to make sure that your teeth are nice and clean. So what I want you to do is I want you to just lay back like a tiny, tiny bit, okay? All right, very good. And then I'm just gonna gently just like brush off some of the plaque, and it shouldn't hurt at all because your mouth is numb, but do let me know, okay? Okay, so. Okay. Much better. Looks much cleaner already. Okay. Yeah, I'm gonna put you down in about like a week from now. We'll go ahead and we'll take care of those cavities. Yeah, but for now, we're just gonna make sure like your teeth are like extra clean, and that should take care of like any problems in the future. Okay. Yeah, you're doing really, really good. Yeah, I know I have some people in here and they're just so nervous, and yeah, that's why we do our best to make sure that yeah, that this is a relaxing visit, and yeah, and also to make sure that your teeth are clean, of course. Okay. Okay, perfect. Yeah, there was a lot of plaque on that back tooth, but I got it. So, your mouth looks amazing. There's just one more thing I want to do, and that's to kind of, I do have a laser here, and we're going to use that to help your gum recession, okay? Okay. This is really good for just like taking care of like any bacteria and then sealing up like any damage. So I'm going to go ahead and I'm just going to, I'm going to just treat just like the bottom of your teeth, because that's where I do see a little bit of gum recession. But first I do want to put on this medical grade mask just to make sure that, yeah, we don't transfer like any bacteria. Okay. Close your eyes if you'd like, and just open your mouth just like before. Yeah, this should just help like, yeah, with like any bacteria, anything like that, and just make sure that like everything's clean. So I also have these floss sticks, and I just want to make sure that we have any debris removed from your teeth. So I'm going to gently floss your teeth, and then we can set up your next appointment, okay? Yeah, there's just a tiny bit left, so you're fine. Okay. All right, perfect. Okay, so I do have this bag here, and what I'm going to do is I'm just going to leave you with some product to take home. We have the Act Anti-Cavity, and the Listerine, okay, and then I'm also going to leave you with the closest. This is the unflavored mouth rinse that we talked about earlier, and I do recommend using these products once a day. Yep, start with this one because it's really good for like the pH, okay? Okay, perfect. So now before we go, I'm just gonna set you up with your next appointment, okay? Yep, just 1 second. Let me get my notepad, okay? Okay. Okay, can I just get your name again? Okay. And your date of birth? All right, perfect.